People come for treatment for varicose veins for three reasons. They may be concerned about the appearance of their leg. They may have symptoms like aching and itching and discomfort. And they also may be worried about complications such as deep vein thrombosis, leg ulcers, bleeding and such like. So it's really important when you see the patient to work out what they're expecting and hoping to achieve. And based on that, we then make recommendations as to what treatment would best suit them for their veins.
I've had one leg treated. It was very straightforward. It took about 15 minutes for the procedure, and then afterwards it was bandaged and been bandaged for a week.
I had an operation to remove the veins. It was quite traumatic really. I had the two legs done. I had to wear these stockings for quite a while. And if I remember right, at the time it was quite painful. They did heal up quite good after a while, but as I was in my job working, they tended to come back again. I'm hoping to achieve just a bit more pleasant, not so bulgy as they are now, and help with the pain in my legs. It looks much better than the other operation that I had years ago.
I think it'll make it a lot more comfortable to walk around and get around on my feet generally. And of course rising and sitting down, because that's of course where it used to catch me more than anything else.
The first thing is we talk to them, ask them what their problems are, talk to them about their past medical history, the sort of medications that they might be taking, because obviously it's very important to get that information from the patient and understand what they're hoping to achieve. The second thing we do is do a duplex Doppler ultrasound scan of the veins and the arteries in the legs, because clearly we need to understand the anatomy and where there's an abnormality, exactly where that abnormality is. So we feed all that in and we make a recommendation for them to come and have foam sclerotherapy. So when they arrive, they already know a lot about what they're expecting to have done, and we've got a good map of all the veins in their legs. So the first thing we do is we repeat the ultrasound scan just to map out the veins, and we usually make some marks on the legs just to plan our strategy for treatment. So you can see that this gentleman's got really quite advanced skin changes, a chronic venous insufficiency, and he's had ulcers on and off in both legs for a number of years now. He's on warfarin for atrial fibrillation, and he's recently had coronary artery stents put in because he's got ischemic heart disease as well. So he's on warfarin and clopidogrel at the moment. But one of the advantages of this treatment is that we don't need to stop those drugs, because obviously those drugs are very important for him. And if he was to stop those drugs, that would be a serious risk to him. So that's one of the advantages of this technique. Mr. Bowden had his right leg treated about 5 weeks ago for ulcers that he'd had, what, for a couple of years?
Or at least.
At least, and the ulcers have now gone,
Yes.
I think you were saying.
Yes.
But to prevent the ulcers, as well as treating the veins, to reduce the risks of further ulcers in the future, we've fitted Mr. Bowden with this compression stocking, knee-length compression stocking, which he'll have to wear every day for the rest of his life to try and keep his legs in good condition and to keep the swelling down. So today we're going to go and treat the left leg, which isn't quite as bad as the right leg, but is still affected by ulcers and skin damage from his varicose veins. Can I just borrow your leg for a second? That's fine. You okay like that? Just get yourself comfy. You'll be there for about 10-15 minutes. Well, we like to have 4 access points to the vein when the whole leg is affected, because we like to get fresh foam into each section. Because when we put the foam in, it gets deactivated by blood quite rapidly, which makes it very safe. But what we do by putting extra cannulas in, we can treat each segment of vein with some fresh foam rather than just one point trying to treat the whole leg. And then once we've done that, we get the patient to lie flat and we put their leg up in the air. And the reason that we put the leg in the air is to empty the veins, because when your leg goes up in the air, gravity drains the blood out of the veins. We're going to make the foam now, and what we're going to do is mix 2 millilitres of sterile air, which we've drawn up into this syringe through this filter, so it has no bugs in it, and we're going to mix it with 1/2 ml of the 3% fibrovane STS, which is the active sclerosant, and we're going to mix it through what we call this 3-way tap, and by oscillating the air and the sclerosant backwards and forwards, it will turn from a liquid into a foam, and then we'll inject that into Mr. Bowden. The first thing that happens when you put the foam in is, because it's an irritant to the vein goes into spasm. So the little muscle fibres in the vein contract and make the vein shrink down, and that expels what little bit of blood is left in the vein, because when the patient has their leg up in the air, the veins are pretty empty anyway. And because the foam has bubbles in it, we can see it very clearly on the ultrasound machine, so we can make sure that we fill all the veins and we make sure the foam doesn't go anywhere where we don't want it to go. Then what it does is strip the non-stick lining off the inside of the vein and makes the vein wall sticky. So the vein walls stick together and the vein blocks off. Yeah. So now we've put the foam into the vein is blocked off. If we weren't to put compression on the leg when Mr. Bowden stood up, there would be a tendency for the vein to reopen, which is obviously not what we want to happen. So what we've done is put some padding over the vein and then a bandage to hold the vein closed, and then we're going to put a stocking over the top. And that just keeps the two walls of the vein close together, so it blocks off and scars up over the next few months. When you see and feel varicose veins, the vein wall is paper thin, so what you're actually feeling and seeing in a varicose vein is the blood inside the vein. So if we can keep it empty of blood, the veins will disappear. And then essentially they then go away. We ask them to go for a 10 or 15 minute walk afterwards, and if they're happy, which they nearly always are, they can then just go home. So the whole process takes about half an hour, 45 minutes, walk in, walk out. So this is a European Class 2 stocking, full length stocking. If you just bend
your knee, sir.
That's it. So we've done it in a way that the knee and the ankle can bend, so obviously the patient can walk around relatively easily.
How's that?
How are you feeling now?
Right.
Yeah.
How was that? Would you like to have a week?
No problem at all.
Okay, lovely. All right. Just take your time when you get up, because sometimes people do feel a bit wobbly when they stand up.